Well, hello and welcome, everyone. My name is Steve Stump. You're listening to Health Insurance 411. And today I thought I'd talk about the law that's about to go into effect on January 1. And the industry is given its last bit of resistance and fight to make sure that the law doesn't go into effect. What am I talking about? Well, has this ever happened to you? Have you ever gone to an emergency room and you thought that the emergency room in the hospital was all in network, but then you get the big bill at the end and you find out the doctor wasn't in network, maybe you had an x-ray, the radiologist isn't in network, the nurse isn't in network, and now you've got a surprise bill. Well, that's a practice called surprise billing or predatory billing, and the government is putting a stop to it effective January 1. And of course, the whole industry is fighting against it. And it makes you really wonder, why would the industry fight for something that is really harming consumers? Many consumers actually have to go into bankruptcy or into long collection with these predatory bills that they get from hospitals. And it doesn't just happen with an ER visit. It can also happen if you have a surgery inside the hospital and the doctor you worked with, they might have been in network, but then all the other professionals that were involved in your surgery, or if you stayed in the hospital for recovery after your surgery, you might have had individuals not in network and therefore providing that surprise bill at the end of your stay. Well, January 1 is the date that the new law goes into effect, which puts arbitration in between the providers and the insurers, and it requires them to go to arbitration, and it requires them to start with the medical pricing that is the standard across the industry, and that is Medicare pricing. So why is the industry fighting it? Well, there's a couple of organizations. The American Medical Association and the American Hospital Association is fighting it. Now, what they claim is that to staff an emergency room requires staffing regardless of whether patients go into the room. Well, that kind of makes sense, right? So you got to have doctors and nurses and radiologists and other care professionals on staff just waiting for the emergency to happen. So what they're stating is the cost of those emergency rooms is so high, and that's what justifies their out-of-network billing. And that if this new law goes into effect, then the arbitration, since it's slanted to the Medicare standards for pricing, is going to dramatically reduce their revenue and their ability to actually deliver services for patients. So, of course, the industry is fighting it. The industry has been fighting the high prices of healthcare for many, many years. Now the care providers are in the middle of it. Health insurance was in the middle of it back in the 2010 era when the Affordable Care Act was passed. And this is no big surprise. Well, one of the things that you can do to protect yourself from predatory billing is make sure you work with a health insurance agency that's going to support you in your fight against these bills. Make sure that your health insurance agency can represent you on your behalf to bring those bills down to what's called reasonable and customary rates. Otherwise, you're having to do it all by yourself with lots of phone calls, lots of emails, and it won't just be for the hospital. It will be for the hospital. That will be for the facility. It will be for the doctor. It will be for the nurse. It will be for the radiologist. Each one of these professionals are probably providing you a separate bill that is predatory in nature. And because they're out of network, you get surprised when you see the size of that bill. Well, I talk about this in my video about how the healthcare industry is rigged against you, and you can rig it in your favor. To find out how, just go to www.insuremesteve.com/rigged, and I explain to you why the industry is rigged against you, why it's actually too big to fail, and the government helped rig it against you, but now you can rig it in your favor. Be sure to go check out the video and tune in next time. If you did not like and subscribe in this video, do so now so that you get an opportunity to watch my video tomorrow. Have a fantastic day.